report card is out, and it's grading Central Kentucky hospitals on safety.
5 received C's, only 2 received A's. WKYT's Samantha Valentino is breaking down the report for us in our top story at 4:30.
Baptist Health Lexington and Clark Regional Medical Center were the only 2 of 7 Central Kentucky hospitals to receive A ratings.
We're extremely proud of the A, and meeting the criteria to be at the level for an A is certainly no small feat.
Cliff Wilson is the market president of LifePoint Central Kentucky. Clark Regional and Georgetown Community Hospital are both part of this network. Georgetown received a C rating. The hospital received a 70 for their hand washing practices.
Hand washing is vital. I mean, it's very at the foundation of infection prevention and making sure that hand washing occurs at entry and exit upon all patient rooms or any patient encounter for that matter.
St. Joseph Hospital and St. Joseph East both received C ratings. They also received 70s for hand washing. The average score for all hospitals is 71.64. Chief Medical Officer of CHI St. Joseph Health, Dan Gelson, told WKYT in part, quote, "There is always room for improvement, and our dedicated providers and caregivers continue to focus on quality and safety for the patients we serve." Baptist Health Lexington received a 15 out of 100 for hand washing, the lowest score of any hospital. We asked Baptist Health about this score. They said in part, quote, "We require that all staff wash their hands before and after each patient encounter. We formally monitor compliance to this in all of our patient care areas to ensure that we control infection risk in our hospital environment." UK's Good Samaritan and Chandler hospitals received C ratings. A spokesperson for UK Healthcare told us in part, quote, "There is always room to improve, and we will continue to invest in efforts that improve the health and safety of our patients." In Lexington, Samantha Valentino, WKYT.